All right, welcome. Dr. Miaken is our Monarch Family Chiropractic, and I know we're shifted a little bit here in the office today, but I want to show you more motions and movements today. So we are using, we're going to be interactive today. So I hope for you guys at home, if you have some of these tools that we're going to go over, I encourage you to grab them so we can use them while we're here. So tonight is talking about spinal hygiene using your at-home tools. And we've done a workshop similar to this in the past, but we've talked about using your at-home chiropractic tools. Today, we're going to use everyday household items to do some spinal hygiene motion. Okay. And where I want to start is, okay, so here's where you pause. If you're at home, I want you to grab a broom, a towel, and a tennis ball. So these are your at-home tools we're going to use tonight. If you're here, we have them for you. So don't you worry. We got a towel, tennis ball. Here we go, Brady. Here we go, Bert. So that is there for you. And then I only have one broom, but we can take turns. And of course you, right? The only one who can do these movements and motions are you. I think most people have these items at home. You know, you think, oh, I don't have some of these workouts gear or tools. Guess what? Everyone has these things. So where I want to start is first spinal hygiene where tools are not necessary. Okay. We all have a spine, duh. But that spine is meant to move. Okay. And if the spine is not getting its healthy motion and movement on a regular basis, then it is, you know, it is sedentary, it is locking up, it is not getting blood flow and good motion for all the spinal segments, the tissues that attach from segment to segment for that blood flow for good, healthy discs. Okay. So if you've been in any conversation with me past, I don't know, your initial exam, you've maybe heard me talk about spinal hygiene. Just spinal ranges of motion are one of the best things you can do for your spine. Motion your spine in its normal ranges of motion over and over and over because that's what it needs. Okay. So we're going to do that right now. So I'm going to have everyone stand for me. And we're going to stop sharing so you guys can see me at home. Oops. I want to do that. I want to stop sharing here. Okay. So what we're going to do, like our spine should move through rotation, lateral flexion, and then flexion and extension. Okay. So we're going to start by just going through rotation. And as you're doing this, I want you to take your hands. I'm going to come out here. Take your hands, clasp them behind you. Okay. So you can kind of do a clasp behind just to open up the shoulders. Okay? And what I want you to do is just start with rotation. Keep your eyes open because it gives you your brain good visual input. I want you to go as far as you can go rotation. Now with these, you're not going to go past the point of pain. Okay, you're only going to go to where you're comfortable. And you're going to just do this over and over. And one thing I shared with people is I crashed on my bicycle this summer. And when I crashed, I gave myself a sprain strain. And one of the things I did to help with recovery is I just did my motions over and over and over. Because when you motion your spine, you're bringing blood flow to the area. And you're taking the tissue through its normal range of motion. And over time, that starts to help support good, healthy motion for tissue, spine, all of those things. Okay, so next what I want you to do is I want you to go to lateral flexion. Okay, and I'm going to go right in front of the camera so you can see me. So I want you to do this in front of a mirror because when you go into lateral flexion, your brain always wants to take the path of least resistance. So it'll be like, oh, I can't get there. Oh, now I can get there. See how I rotated? Oh, I can get there. That's fine to do that motion, but I want you to practice straight lateral flexion. Okay, so watch your head going straight into lateral flexion. And you can see as you're watching my range of motion into this motion, you know, is better than as I go to the opposite side. It sticks there. So I'm just going to work through that range of motion. Okay. Now it's okay to get, these motions. It's okay to do that, but I want you to get your range of motion that is normal, right? So as you're watching me on this side, you're going straight laterally. You're not turning and then to get there, right? So then we're going to go into flexion extension. Now, when you do this, you're going to tuck your chin straight back, and then you're going to go into flexion. When you do that, you'll probably feel stretching down into your shoulder blades, maybe even lower. As you come up, keep your chin tucked. Then you're going to go straight up. Keep your mouth closed, and you're going to feel stretch the front of your neck. And I want you to just keep going the flexion extension to the range that feels comfortable. Okay, that should feel pretty good as you're doing that. Now you can do circles. You can't go into circles. That's fine. Just getting motion into your spine. But you should be thinking about spinal ranges of motion hundreds of thousands of times over your lifetime. If you're not moving your spine in a healthy way, then it's not getting the input it needs. Okay. So a starting number that I often tell people is just try for 50 in a day. 50 total. So I don't know, right there we probably did, 10 to 20 lateral flexions, rotations, flexion extension. Now we're going to move into the rest of the spine. Okay, so again, for these, let's just start with rotation. I want your feet about shoulder width apart. Okay, I want it to be comfortable. Okay, you can be a relaxed stance, slight bend in your legs. Then you're going to go into rotation. Okay. And as you're doing this, just see how it feels from right to left as you're going to that motion. Now I want you just to start going through this motion, but you can grab your arm and pull it if you want to see how far you can go into range of motion, as you do that. But for now, we're just starting with just seeing what your motion is. Okay. Then, this should feel really nice. You can focus on turning through the low back, and then as you pull, that gets more of your mid-back motion. You can just separate between your low back and your mid-back. Okay. Now I want you to go into lateral bending, okay, or lateral flexion. So again, as you're doing this, your thumb's going to be opened up. So I always want you to open up this way because everything pulls us this way. So you're going to be thumbs are opened up and you're bending right to left. And as you're doing this, you're going to almost, I don't know if you guys can see me at home. You're going to reach for inside thigh, opposite side. You're going to go straight to one side, reach for the inside thigh. And as you're doing this and getting more motion and movement, more flexibility, you can reach lower down into that thigh. Okay, but you're really working to get lateral bending. Okay, how's that feeling for you guys as we're going through just ranges of motion? Good. Are you fatiguing or getting tired? Or does it feel good?
Feels good.
Feels good. Right? So like, in between.
Well, still lower back.
Okay.
Yeah.
And again, I want you to listen to your body for this. So I know we're going through a lot of repetitions. Now this last one, this is going to be rounding and extending. And the biggest thing with this one is I've actually been practicing this one at home. It's kind of like cat-cow, as you round and extend, but you're doing the whole spine. Okay, so let's see if we can see. So you're going to start with your chin dropping down, and then you're going into mid-back where you're really trying to round segment by segment. And then as you do this, you're really trying to round through this low back. A lot of times you don't get this movement. So there's whole chunks that move here as opposed to really working to round through here. And then you're going to go all the way down to where your body allows. And then you're going to go up, rounding, rounding, rounding. Okay. And then you can open up into extension. Okay. Now, once you get into a lot of this motion, you can open up into extension and really go into extension. I don't want you to start there. I just want you to start getting comfortable with moving into flexion, right? And think about, again, round, and how can you pinpoint those areas along your spine to round through here, right? So round all the way down. This is gonna be harder down through here because it's not used to that rounding. Good. You can have a bent knee here if that's more comfortable. Good. And then you go all the way down. And then all the way down. And go ahead and stretch if you want. You can hang and sway. But then you're gonna come back up. These are called Jefferson curls. Some people use weights once they get into this motion to help weigh you down and give your spine some traction. But again, we're just getting good motion into the spine, and this spine is meant to get this input all the time. Okay, and you might be sore after you do this. You don't usually get this intention, this motion into your spine, especially when you get into extension this way. You don't get a lot of that because we're so forward folded. So really give yourself some grace to really work into this extension motion. And again, I mean, think about how can you get cumulatively 50 in a day, right? You're stopped at a stoplight. Oh, I'm going to get some of my motions in. You know, I'm going to get some motions while I'm standing in line at the grocery store. Oh, I'm traveling. I'm at the airport. I'm going to rock out some motions, right? How can you continually get spinal movement? That's the biggest. My hope is you don't have to make this fancy, right? You don't need all the things to do spinal motions. Range of motion, if you just do this, is going to be huge for your spine. Okay. Okay. So let's move back to, let's share my screen here. And let's move back to our workshop here. Okay. So I'm sorry for you guys in the class today, because you can't really see these postural pictures. You're welcome to step forward if you want to. But I put up a couple posture pictures because I want you to look at your posture and see, oh, if I'm seeing some of these distortions, this is maybe a place where I can start, okay? But first, as you're looking at this guy here, I want you to look at his arms. Let me get a annotation here. I want you to look at his arms. Look here. Do those arms look symmetrical? Right? How are those thumbs facing? Facing in, right? And this side is worse than that side, right? He's got rotation happening through here that's pulling those hands in. If you ever see the backs of the palms, you know that your shoulders are no longer engaging and activating to hold you back here. Okay, so there's an upper back motion that you can do, but there's some shoulder motions you can do. So that's where we like the broom. And for you guys here, I'm gonna have you use the towel. Because the towel is the same. So everyone, I think, has, you know, a broom at home or a pole of some sort. But one of the easiest things you can do is just go into circles. And the wider it is, the easier it's going to be for you. Okay, even this for me is a little bit narrow, but you're just going to go from front to back. And that's where if we have more of a resistance band, if you feel like I just can't get back there, that's okay. Just even doing this motion is going to open up the shoulders for you. Okay, and you're just going to go back and forth. Again, this should feel pretty good to your shoulders. Yeah. If you want, maybe you can try this. Do I have anything in a stretcher? Let's see what I got for you, Greg.
Shoulders aren't moving.
I don't know if this is something that will.
Just something like unicorns.
I mean, you can try, this may stretch. You can try this one. See if I don't know why you're.
Oh, yeah.
That's better. Okay,
Yep.
so that's a swaddle, you know. I could have folded it.
Oh, it's ready to poo, okay.
But again, just back and forth. Now you can do like one arm at a time. So I'm going to go right over my head. right over my head, come down to my waist, and left over my head, come down to my waist. Now, as you're doing this, the goal is to keep your arms straight. And as you work to open up those shoulders more, you can narrow your grip, and you actually go all the way back there. How's that feel for you guys?
It's better now.
Yeah, feels better. When you got the right width, should feel pretty good.
Yeah.
So then
Band,
go ahead and do
work or no?
circles for me. So one hand's gonna go over, and it's gonna rest at the waist, and then the other hand's gonna go over. You can go both sides. This is just activating the shoulders, okay? We want to see if we can bring the shoulders back to open you up here. Again, when your chest, you're doing a lot of forward work, your chest is really closed down, really contracted. So this is gonna open you up, not only shoulders, but open up the chest as well. Now, what I want you to do, once you've got a couple of those, now I want you to hold, oh, see, this is where the broom is nice. I'll let you guys each try this. But I want you to hold the broom at the top of your shoulders, and then I want you just to go into rotations. Okay? And then you can also go into lateral flexions. You can also try, and I think the broom is nice because it allows you to stay in one plane. So I'll let you try this, Bert. Then we can just pass it around so you can see what it feels like. To have something just show you straight into one plane and not allowing for a lot of deviation. How's that feel, Bert? Yeah, feels pretty good. Probably feels pretty good for you guys at home. So again, if you want to be more structured in how your spine is moving, you can use a broom to go into rotation and to go into lateral flexion there. And especially when you go into lateral flexion, it really shows you, oh, this is the plane I'm working at. It doesn't allow you to really bend forward or rotate, right?
What was the other one?
I really just said rotation
Oh, okay.
and lateral bending. And just as I'm doing that, I'm like, oh, I feel pretty good through those shoulders, right in that back.
Sure.
Another thing that I want you to look at on this posture picture is right here. When you're looking at the lateral spine, you see this forward head shift. Okay. This is where it's easy to go into flexion, right? It's easy to go into flexion, but when we want to go into extension, oftentimes we feel like, oh, that just doesn't move as well. And again, that's where extension is a lost motion and posture for modern day activities. Okay. And so that's going to be big for anybody who's got forward head shift, increased curve through your, through this upper back area. And then you're seeing rounding the shoulders. Now I'll talk about this too when we get into using the tennis ball, but you see how he's got some toeing out happening on this side, but it's more on this left side. You see that? Your feet should be pointing straight forward. Okay. So we're going to look at using another at-home tool to address that. But next, what I want to go to is, close this out, is using a towel. Okay. So a towel can be really nice to get some stretches in, and especially to protect your back. Now, one thing I want you to notice with this posture picture, so this is somebody who's different. You see how they're doing, it's almost like a ski jumper posture where they're forward moving, like they're forward, especially through here. Sorry, let me make sure at home sees this. This one. Their pelvis is more forward down through here. You can see how the knee is bent and they're just more forward. When you have a more forward pelvis, your hamstrings are really taut and tense, and your hip flexors, which when you're sitting are contracted, so you're really taut and tense through here.
Sounds like me.
Yeah, and it's a lot of people too. You're not alone there. So we want to look at when you start addressing what's happening at the feet and the calves, because when your hamstrings are taut, it starts to pull on the calves. So a lot of times calves can feel really tender. So sometimes when we're trying to bend down or trying to pull the toe up, it can be challenging. So this is where I like to use a towel. Okay, and let me see here. Let me stop sharing. So I'm gonna have, I would take your shoe off if you're at home. You guys are welcome to take your shoe off here. I'm gonna lay on the table, but you can do this seated as well. Let's see if I can move this down. Oh yeah, you can move this down. But what's great is you can just take the towel, okay, and you can use a towel to give you a stretch through your calves, right? And then you can actually even do some, like, this is isometric when you're holding, an isometric stretch. When you add in some motion, that's called something else. It's not, that just totally, anybody, what's outside of isometric? And you're getting motion. Anybody can chime in.
I know a word, but I don't know. if this-
There's a word, I can't think of it.
Genetic.
Kinetic.
But-
Kinetic, there you go.
Well, I don't know if it's kinetic, there's something, but I can't think of it.
Isometric.
Yeah,
Or dynamic.
we'll go with that, we'll go with dynamic or kinetic. But what you can do is take it from an isometric stretch, and then you can push through and give some resistance as you do some pointing of the toe. Isotonic. Oh, isotonic.
There you go.
Thanks, Kayla. Kayla with coming through with it. Sometimes it's hard to get down to the calf, depending on how old and how flexible we are. Sometimes we see, people who are just into their later decades, it's just harder to do some of these motions. So that's where a towel is nice. So if we want to do the calf, and we'll get into using the tennis ball here in a second, to use and get this stretch down. Again, you can be here and pull. You don't have to have the foot in the air. So whatever is comfortable for you here. Another one we really like is a piriformis stretch, which is crossing your leg and then pushing down. You're going to get this piriformis, which attaches right along your sacrum, all the way around to the hip. Okay. It's a figure 4 stretch, but a way to do that to protect your back is when you're laying on your back. And sometimes it's hard when you're laying on your back to pull this. So you can use a towel to pull your leg towards you. So if you guys want to try the tables, you're welcome. You want to try that because it's a nice stretch here to do that. Where you go right around your legs, you cross your leg, and then you're going to pull. And actually, you can just put it around the yeah, so I would just put it, you've got your leg crossed and it's going to be around the straight leg. Okay, whether it's straight this way or bent this way. And it's going to allow you to get that stretch through this right side. So the leg that is crossed over is the side of the piriformis stretch. So if I'm doing the other side, yep, you're going to lay back, and then you're just going to pull towards you. And you may not need a lot, but yep, that's exactly what you're going to do. You're going to feel a stretch, Greg, on that right side. Yep. Piriformis stretch, I think, is great. It's tight on a lot of people, and when you hit those toes that are pointing out, a lot of times it's the piriformis that's pulling those toes out because it's so taut and tense. It's the only external rotator of the hip. So if it's externally rotating the hip, it's going to pull that toe out. So oftentimes, again, if we go back to our PowerPoint here, and you guys are good, keep stretching. When you got this toeing out, especially more on this right side for this person, you can see if they address those piriformis, it may help support how they feel through the pelvis, how they move through your pelvis when you're weight bearing, and really align those feet as well. And when you address what's happening through the calves and the tightness in the calves, address the stretch through your hamstrings and the piriformis, you get the back posterior chain, then we can oftentimes see some change happening through the rest of the body. So now I'm running short on time because I started late, but The last one I want to look at is a tennis ball. And a tennis ball can be really great. To use for more pinpointed trigger point work. Okay, so if we stay with the feet, one thing you can do with the calf is, and the tennis ball, is you can use your hands to rub the calf, or you can literally put that tennis ball, I don't know if you guys can see, tennis ball right underneath the calf like you're foam rolling. Sometimes a foam roller is too intense for the calf, so that's where a tennis ball can really be really great. And I actually found when I was laying on the floor using my tennis ball, it felt really, really nice. It was nice pressure to work through the calf. Another thing I think is nice is if you have plantar fasciitis or you really want to address healthy arches, you can use a tennis ball right on your arch. You know, if you're working at a desk, you can have that tennis ball right at your feet, and you can just really gently, you can control the amount of pressure you're putting down, and you can just work those arches.
Circles.
You can do circles, you can do back and forth. You can go from the heel all the way to the ball of your foot, circles, whatever feels good for you. Again, be gentle here. You overdo it, you can overdo it on these, right? One thing I really like for hip flexors, sometimes it's hard to get into where your hip flexor is. So I'm going to show you this. But your hip flexor, a lot of times when Doc and I are working through this area, because you can, you know, put that ball through there and work that spot. Women, it's a little easier. Men, you have to be a little bit more careful because you got some important organs here, right? So usually you go right on that bony spot. You know, here's the top of your pelvis and that hard bony spot right in the front of your pelvis. You're going to go around just into that bone, and you can go towards the top too, because your hip flexor attaches along this iliac crest, then it goes down into attached through the hip. You'll lay on your stomach to do this, and oftentimes I like to do that on a mattress because it's a softer surface. Okay, but if you're doing this, you should try this at home. But if you're doing this, you're putting that, you know, I would start with putting that ball where you think it should go. Then you're just going to lay on the tennis ball and really find that spot where it feels good. So again, you can be up higher here, or you can work down towards right on top of the hip. And usually that feels really good. Again, it's just, sometimes you can hurt yourself. So that's where I would go less is more, and make sure you know where you're putting the tennis ball, and start with laying on a mattress, because the firmer the surface, the harder it's going to be. Does that make sense?
Yep.
Let's go back to, and then shoulders. Okay, now if you're ever using a tennis ball on your back in certain areas, a lot of times you can put this in a sock, like a tube sock, and you can help hold that tennis ball in place. I don't have a sock with me, but we're going to use a nice place to use a tennis ball is your shoulders. And what you typically would do is, if I'm putting it on my right side, okay, I'm crossing my shoulder, the arm across the front of the shoulder, and I've got it on the right side to open up the shoulders. And what I'm going to do here is I'm going to go right up against the wall. Okay. Oops. This is where the sock is nice. So get it right between the spine and the shoulder blade. And then you're going to cross your arm. This can feel really nice. And then you can use your body weight to see what feels nice. You can work all the way along to the top of the shoulders. But a nice thing to do. You guys are welcome to find a wall and see if you do that. Just to open this area up if you want to try that. But again, putting it right here, crossing that shoulder, and really working through.
Tree down there.
And here's a wall too, if that's easier. Or yeah, if you want to try that right there. But usually that feels really nice. Can you get it there, Greg? And I would put it right between the shoulder blades. Yep, right
Okay.
there.
There.
And then cross your arm over here, and then you're gonna lean up against that and work to that shoulder. How's that feel for you? Sometimes it's really nice because you can be more targeted with getting motion into that portion of the shoulder. Sock, put it in the sock because it can be really beneficial. As you guys are practicing that, the other place we like to use it is if you've got forward head posture. Oftentimes it's really lengthening these muscles here. Your suboccipitals are really tense and tight. So we like to use this on your suboccipitals. So right along the base of your skull. You can use 2 at a time to get both sides. But this is something where you're laying on your back. You got this right on the ground, and you're just putting it right at the base of your neck, and you're rotating. You can rotate, you can go up and down, but just really working the suboccipitals. So this is something you do. I think it'd be really difficult if you did it trying on the wall.
Just below.
Yep.
The little knots.
Yep, right there. So again, it'd be nicer to do with 2, but again, you're just gonna put it. Where did I picked the wrong table. So yeah, right at the base. And you're just going to rotate. Definitely do it with 2. So you can balance the 2 of them across the way. But rotation and flexion extension can be really nice. If you have a headache, that's also, a lot of times you have trigger points right up through there. So you might feel referral of some of those headaches that you get when you work through the suboccipitals. That can be really nice. There's more things that you can do with a tennis ball. There's more things you can do with a towel. It's just wanting to really introduce, tools that you have at home that you can start getting motion into your spine. You can start doing some trigger point work in areas that you are feeling tension and discomfort. And they're really simple. It's just doing them. And I would say the biggest one is once you start doing your spinal ranges of motion on a regular basis, you're going to start noticing better motion through your entire spine. Probably not going to be feeling as stiff and tense. And, these are just added benefits of getting flexibility and motion, working through your body with stretching with a towel or using a tennis ball or using a broom. So thank you for hanging out with me tonight. I know I went long. But I hope that as you were doing some of this stuff at home, you were able to experiment a little bit and find some ways to get some better motion and do some different types of spinal hygiene that are easy and available. So, so it is 6:30. I have gone well over my time, but I appreciate you being here. And if you have any questions, or if you experiment with anything, or if you have, hey, I use actually this thing at home, please let us know. We want to know that. But thank you. Next week is Thanksgiving. It's one of my favorite times of year to be just in a space of gratitude and intention around emotions and feelings of gratitude. So we're going to go over how gratitude impacts the brain on next week's workshop. So I hope you tune in for us there. But otherwise, thanks for being here. Yeah, and I would say